Good afternoon, fellow students. My name is Dmitry Starchik. We are again continue our rather finishing our anatomical lecture course today, and we have the last lecture before vacation, and today's topic will be about vessels, circulation systems, arteries of the systemic and pulmonary circuits. As I see today present three persons: Mohammed Magdi, Nuran Ramadan, and Abdallah Al-Okla from different group. That's nice. Oh, I see another person joined to us. So let me know before I start the lecture. Let me know, as usual, how is the quality of today's translation. And this is a lecture. Okay, thank you, Ahmed. This lecture is a continuation of the studying circulation systems and cardio circulation system. Last lecture we talked about the heart and the main organs, but today we will discuss anatomical organization of the circulatory systems, and we will talk about main and largest arteries in our body. Excuse me. Hello? Да, сейчас я вам откроют вам. Вы въезжаете через шлагбаум, поворачиваете налево, никуда не сворачивая, через 400 метров вам встретят, заедете во двор, разгрузитесь. Хорошо? Спасибо, спасибо. Да, сейчас вам открывают и встречают. Спасибо. Угу. Да, Лена, открывай, пожалуйста, звони туда и все. I'm sorry, it was important call for me, and let's start our presentation. We will, as you see, the main issues today are classification, general features of the vessels, some of physiological and functional characteristics, and we will just touch to the arteries of the different areas of the body, because the sixth issue is just for self preparing and teaching in the practical lessons. Okay, so let me remember you that cardiovascular system is a system where the main organs is heart and some of vessels or vascular systems. That is the two type of vessels: blood vessels and lymph vessels or lymphatic vessels. What is the difference between blood and lymphatic vessels? Blood vessels contain the blood inside. It is a red fluid. You know how it looks like. And lymphatic vessels is a little bit different because that is a transparent fluid. You usually know, I think you maybe have ideas how it looks like, but we will have special lecture about lymphatic system. Just trust me, that is a different fluid, and it looks like tonic, maybe without gas, but it is absolutely transparent. We will study arteries and veins. What is the difference between arteries and veins? Arteries are vessels that they transport blood from the heart to the tissue, to the organ and tissue. Veins, in comparison with the arteries, take blood from organs and transport it to the heart. That is very easy to understand. The part of the anatomy or section of anatomy studies blood vessels, called angiology. It comes from the angion, means blood vessels. It is, of course, a Greek word. As I said, difference between arteries and veins is the way where they transport the blood. Take a look and notice that arteries come from the Latin Latin term air. It means air. It means air. That our ancient anatomists thought that arteries contain air, so they put this name in different books, but of course it was the fault idea. No air is in arteries, but historically this term still used. As you see, lymphatic vessels have different kind of vessels. First is vessels, they are small, trunks is bigger, and the largest lymphatic vessel we call ducts. There are only two lymphatic ducts in our body, but we will discuss it later. What is the main functions of the circulatory systems? First idea, that is that all of these vessels transport or carry out transportation of the different substances, nutrition substances, from one area to another. That is like a tube in the garden. Take I hope you have ever planted some garden, and you probably know all about the irrigation systems, and that is the same. Irrigation channels are in our body, and that is the blood vessels. They transport, as you see, nutritions. They transport metabolic products, what we don't need more in our body. gases, of course, that is the oxygen and carbo-oxygen gases which are diluted in the blood. Поставь просто пока мы потом разберем. Sorry. Of course, that is blood is the place where all hormones are contained. They transport the blood transport hormones, and by this way it regulates main function in the body. Of course, that is transport some protective substances, and this is also transport of the energy. When we feel cold, some of our parts feel cold. More often those are hands. We just make energy moving of hand, and the blood come to the tissue and makes it warm. And the main function of the blood is exchanging gas and metabolic products between blood and air in the lungs. Alveoli, this is a small structures in the lungs, and there you probably know it is places for process exchanging between blood and atmosphere, air we inspire. Which is a couple of what I'd like to say about history of the anatomy of circulation system. And first name which I'd like to call, this is Claudius Galen. He was very famous anatomist and surgeon in the beginning of the first centuries after Christ's birth, and he lived in Rome, in ancient Rome, and studied anatomy, but mostly he studied anatomy in animals, not in human body, because it was prohibited that time. And he found that heart is and different blood vessels, and he knew that heart worked as a pump and push blood through the lung and take air from lungs. He also considered that circulatory systems is opened. It means that no connection, direct connection between veins and arteries and veins. And some of idea was false. But his book about anatomy book was very popular in Europe, and a lot of ideas, Galen ideas, were lived until 19th century, as well as the blood letting, that is procedure that doctors used for for treatment of patients, used for treatment, because they considered it is necessary to make patient feel much more better. Of course, it is not true, and now doctors don't use blood letting more. Another doctors and scientists, which I'd like to show his picture, was Miguel Servetus. History shows that more discoveries have predecessors who are preparing. It means the first idea about some of intentions was just as a hypothetical idea, and Miguel Servetus was the first who insisted that there are two circulation pathway or two circulation systems in our body. But he lived in the period of time when Inquisition was very strong, and he was accused of heresy and burned. Unfortunately, he was burned at the stake of Inquisition in Geneva. But he was the first. Then another scientist, very famous, that is a very famous name, very famous person, William Harvey. He lived in 17th century, and he discovered that there are two circuits in our body: pulmonary circuit and the systemic circuits. In other words, we call systemic circuits as a large or great circuits, great circulation, and pulmonary small. This is another term. You see these two circuits in our body. First is the systemic or large circulation. It starts from the left ventricle, then it continues in aorta, the main and the largest arterial vessel in our body, and from aorta there are a lot of branches come to different organ, and they transport the blood into veins. Veins collected non-oxygenated, deoxygenated blood and bring it to the right atrium. That is the end of large or systemic circuits. This is systemic circuits here. And second small circuits we call pulmonary circuits. It starts from right ventricle, from here, and one vessels called pulmonary trunk come from this camera of the heart, and then it divided into the right and left pulmonary artery. Right pulmonary artery come into the right lung, and left pulmonary artery continue in the left lung, and then it transports in lungs blood take off carbo-oxygen and take oxygen instead of carbo-oxygen, and then collected in two veins from each lungs, and they those pulmonary veins flow into the left atrium, and that is the end of pulmonary circuits. So the main idea of pulmonary circuits is to change carbo-oxygen to the oxygen. But the systemic circuits, it is the transport of sorry, hello. Я не понял, что случилось там у вас, что? Так сейчас откроют вам, да, вы другую? Хорошо, пожалуйста. Ага, пожалуйста. Sorry, this is some not very willing business what I'd like to maintain. Okay, let's continue our lecture. And so thanks to the William Harvey, we all of anatomists in the past and now talking about two circuits in our body, and with a different idea, different meaning. Only idea which was William Harvey didn't know, it was how blood come from artery and come to the veins. And Harvey couldn't explain this fact, but because he didn't have microscope, and only later Anthony van Leeuwenhoek, after his invention, he invented a microscope. Another anatomist, Marcello Malpighi, you see his picture here. He lived in 17th century, a little bit later than William Harvey, and who discovered the blood capillaries. What could see Malpighi in the mesenterium, that is a transparent and thin layer in intestinum tenue, and he observed and watches small capillaries. You see also these vessels which are not visible without magnification, and he add some ideas to William Harvey theory about blood circulation in our body. As you see here, the numbers of different container the blood containing vessels and parts of the cardiovascular systems, and you see that systemic circuits systemic hyocards, contain about 84% of the whole blood. Veins have 64%, arteries 15% of the blood, and capillaries only 5%. Pulmonary hyocards is smaller because it contains only 9% of the blood, and 7% of the blood is located in the heart, in our heart. That is the relations between different hyocards and heads as well. Interesting fact is how typical blood vessels is organized. Histologically, almost every vessels has 3 layers. The first layers, external layers, called tunica adventitia or adventitia, is just a connective tissue which isolated or limited the blood vessels from other tissue. The second media, tunica media, contains from smooth muscle cells, and it provides contraction or possibility to contract vessels. And the internal layer we call tunica intima is the layer which contact with the blood cells, as you see, with red and white cells in our blood. Here is the structural differences between arteries, capillaries, and veins. Let's start with arteries. The main or the largest arteries we call elastic arteries because its wall contains a lot of elastic fibers. Such vessels as arteries as aorta, bronchopulmonary arteries, and they play a role to when heart pump blood, it make elastic artery with more volume, and they contain more volume, and then it became less. So we watch the process called pulsation when different arteries, elastic artery, changing their volume, changing their diameter. Usually is such arteries we found very thick adventitia and a lot of elastic fibers and in the media layer, and that it is like a resin container, and which provides the transportation of the blood and to increase the difference between high and low blood pressure. Second group of artery we call muscular artery, number 2. This is arteries which diameter not more than 4 millimeters. Usually this wall thickness is about 1 millimeters. And as you see here, the largest thickness has the media, tunica media layer, and it contains mostly smooth muscular cells. It means that such arteries are responsible for contraction of the artery, and in the result of such construction, blood pressure becomes high, because the volume of the arteries make of all arteries make lesser, and that comes to the blood pressure hypertension. We call it hypertension. The third group is arterial. That is a small arterial vessels which has a diameter usually about from 30 to 100 micrometers. It is a small artery. Usually they are not very good visible without microscope, and histologically they don't have adventitia, only media layer with smooth muscles, because it is visible as a red layer, and of course the intima. Usually that is only one layer of cells in the intima located in the basal lamina. Then arteries continue in capillary. This is the smallest vessels in our body. Most capillaries we call continuous capillary. That is typical capillaries with diameter no more than 8 micrometers, or that is the smallest vessels. But another group of capillary, we call them fenestrated capillaries, because all of capillaries have only one layer, that is the internal layer, intima, and usually it is just one layer of cells connected each other and make the flat surface, internal surface of the vessels. Because capillaries are responsible for changing different liquid and gas, they don't need have thick wall, only one layer of the endothelial cells. You see this term here, endothelial cells. Only they are in the internal layer. But fenestrated capillary have diameter more than continuous capillaries, and it is usually about 15, 20, or sometimes 30, no, it's too large, about 25 micrometers, and they have some openings between endothelial cells, and this opening we call fenestra. Fenestra means window in Latin, so it is window, we call it in English window capillaries, and they usually are located in some organs with the special function. For example, such capillaries we could see in liver, in the large gland of the digestive system. Then blood come to the small vessels called venulas. Venulas, as well as arteries, have two layers, but there is no muscle cells in venulas. They have adventitial layers and endothelium, internal layers. No muscle cells. That is the one difference venulas from arteries. Another difference is that diameter of venulas usually are more than arteries, and that is typical for all venous vessels, and there is no exception and for venulas. The group of medium sizes vein usually transport blood from different organs in the direction of the heart, and diameter of such vessels are from 2 to 10 millimeters, and they have quite they have wall which is quite thick and contains all typical layers. Adventitial also have media layers with smooth muscle cells and internal layers with endothelium. And you see that adventitial layer is more and large than in the arteries. Usually medium-sized veins they are located in the same area which are muscular arteries, and usually they pass through our body together, and we call them as a Sputnik or vessels which every located nearby. The large group of veins, we call them large veins. That is usually the thickest, the most thickest veins in the body, and such veins we see which flow into the right atrium of the heart, and call vena caves. Vena cava. They also have large adventitia, small media, and in intima as well. That is the typical histological and anatomical features, characteristic of the vessels. If we take a look in histological section of arteries and vein, we see that usually the arteries wall is thick and vein wall is thin. If they are path together, and here the different cells located in the different layers of the artery and vein. I hope it is clear. Talking about blood pressure, in arteries and vein, we could find the difference. First of all, arteries have positive or sometimes high blood pressure. Especially the highest blood pressure is in the largest arteries like aorta, abdominal part aorta, and in the lower limbs. In vertical position, the femoral arteries has this, almost the same blood pressure the different situation is in veins. The blood pressure in veins depend on the position of the vein. In vertical position, you see that lower limb veins have positive blood pressure, but the veins of the neck and veins of the upper arm, especially in the upper position, is under the zero. It means if such a vessel will be open, the air from outside can come into the veins and come into the heart. It because the veins have quite lower blood pressure. Because of the low pressure in veins, they have special structures located on their walls and called valves. Only veins have valves. There are no valves in arteries, and such a structure like venous valves help blood to move in only one direction. Which are the factors help blood flow in the one direction? That is, of course, pulsation, artery pulsation, which contract veins and push the blood in the heart direction. And of course, that is the muscular contraction. When we move our body, when we move our limbs, the muscles contraction push the blood, and valves help it to come to the heart. Interesting diagrams I'd like to demonstrate to you, and as an example, as an illustration of differences, different features of blood circulation. Let's start from numbers. The first diagrams is number of vessels. Only one largest artery is aorta. Then we see increasing numbers of vessels, large arterial branches, arterioles almost that is I think is 160 million arteries in our body, 5 billions capillaries, and then we see decreasing of numbers, and only 2 large veins come in the flow in the heart. Next characteristic is diameter of vessels. As you see, diameter of aorta diameter is about 3 centimeters. Then we see decreasing of diameter, and the smallest vessels are capillaries, and their diameter is no more than 9 micromillimeters. It is very small and non-visible vessels. Then we see increasing of diameter, and the cava, inferior vena cava and superior vena cava have diameters about 3.3 centimeters. Total lumen or total cross-sectional area of the vessels, we see that the largest cross-sectional area is absorbed in capillaries net, and then it is also in the veins and arteries. It is small, is minimal. Flow velocity or speed, in other words, that is the highest speed is in arteries. Then it is very low, about 0 centimeters per second in capillaries, and it means the blood flows very slow in the capillaries. That is a minimal range of flow velocity, and then a little bit increasing we absorbed in venous. And the last diagrams is about intravascular pressure. In the first group of arteries, we observe the pulsation. It means that some of high position of blood pressure, or the maximal blood pressure and minimal blood pressure also, and such pulsation, we call it pulsation, and such pulsation we found when we observe patients and calculate their heart rhythm. Okay, and of course you have be very good informed about different kind of blood, of bleeding. When it is a most often situation when people cut yourself and see capillary bleeding. That is bleeding when we see weak flow and color of the bleeding blood is bright red. It is not a danger situation. You have to put some tape on the wound, and that is enough. Venous bleeding is different. We see the quite intensive flow, and the blood coming from the vein is dark red. So it is a typical characteristic: moderately flow and dark red blood. The dangers in such situation, we need to put some band-aid, and usually if blood is stopped, that is enough. But the most dangerous situation is arterial bleeding. Usually we find pulsating stream, and we see the stream such as like a thin spritz, thin stream coming from the artery, and the blood is scarlet, or it is a difference. This situation needs some special help, medical help, and usually it is the special not band-aids, it's the tape. It's a special tape which should be put proximally to the place of the cutting, and it stop bleeding. But such patient need to be transported in the hospital because they need in surgery operation. Couple of words about organization of terminal vascular bed, which called microcirculatory bed, and all of these vessels are visible only by microscopic examination. And basic organization of a typical capillary bed is that we found the arterioles. It is the first section, first part, first group of terminal vascular beds vessels, and then the blood come in the precapillaries. That is smaller arteries, usually contain muscular smooth cells, smooth muscular cells, and continue in the capillaries. Here you see different capillaries between precapillaries and coming together and combining together, they form postcapillaries, and all postcapillaries join each other. They form venules, and venules then continue in veins. It is very easy, and such 5 segments or 5 group of microvascular beds usually are found in every tissue and every organs. Here the name of and small characteristic for each segment of microvascular bed vessels, or we call them terminal vascular bed vessels. Then I'd like to show you different structure of capillaries. Here the typical capillaries, and they have only endothelium cells, but they are different from the fenestrated capillaries, where we see some of opening in the capillary walls called fenestra or windows, and that such as windows, such as fenestra, are between endothelial cells. Interesting mechanism of capillary of blood circulation through capillaries, or organization or the physiological regulation capillaries flow. It is responsible. It is connected with the special muscular sphincters located in the beginning of precapillaris, and when these cells are relaxed, the blood come into the capillaries without problem, and we see changing of nutrition and oxygen in the tissue. But when these sphincters are contracted and they close precapillaries, and no way it is not possible when blood come into the capillaries, capillary bed. Such regulation depend on the concentration carbo-oxygen. When that I hope you understand what I talk about. Carbo-oxygen, that is the CO2. CO2, that is the gas diluted in the blood, and that is the product of metabolism, the most metabolism product. And concentration of carbo-oxygen regulate the contraction of the precapillar sphincters. When concentration is high, the contraction stopped, and the sphincters are open and blood come into the vessels. And it is of course very easy to found if you watch and take searching of microvascular bed. Arteries resistant vessels. There are three classes of the arteries in our body. First group we call conducting arteries. They usually are elastic or large, and usually they just transport blood, and they don't have they don't take a part in changing of nutrition. Distributing arteries usually regulate the volume of arteries in organs, and they are responsible of the volume of blood, because they have muscular layers which and contraction of these layers come to the small blood flow, small blood passing through the organs. And in the end, the last group of arteries is named resistance or small arteries. They usually responsible for the for the blood circulation in the organs or in their part, because these arteries are very small. They also have muscular layers, and depend on the contraction of muscular tissue in the arteries wall. We will see the low or high circulation in organs. This process of the circulation depend on the some group of baroreceptors located in the aorta, and large arteries located in the neck, in our neck. And usually there are 3 points with such baroreceptors. Carotid sinuses, that is here. Carotid bodies is here, and in green we see different baroreceptors located in the aortic arch. Such receptors connected with the brain, and they start reflexes, start reactions to continue in the high heart rhythm or the low heart rhythm. They regulate heart rhythm, and then they control the blood pressure in the whole body. I hope that is quite clear. Patterns of distribution of the artery in the body is the main features or main characteristics of the arteries in human, and not only human but also in animal organism. First feature is that arteries are located along the neural tube and nerves. It means they are located parallelly or along with the main nerves and even spinal cord. As you see, aorta, the main vessels, main arterial vessels in the body, is located parallel to the spinal cord. Most of the arteries located according to the principles bilateral symmetry. What does it mean? It means that usually we observe absolutely symmetric organization of arteries for limbs, for different part of body. It means if we have right renal artery, so we have also and left renal artery. If people have 2 kidneys, it means they will have 2 renal artery. The same organization we see in limbs. That is iliac, common iliac artery that's here, and there are left and right common iliac artery in the body. The third feature or third characteristic is that in the proximal part of the limb, which have 1 bone, such portion of the limb is femur or shoulder, thigh or shoulder, we find one main vessels, and it calls brachial artery or femoral artery. In the middle section of limbs, such as the forearm and shin, typically are two main arteries. For example, in forearm we find radial and ulnar arteries, and as well tibia and tibia anterior and tibia posterior. Sorry, it's some mistake here. And this artery is located in the shin or crus. But in the distal regions of limbs, usually we see the 5 arteries coming correspondingly to each digital ray. So the distal artery locates the more numbers we see in limbs. Here the patterns of distribution artery in the body. Usually artery come together, they accompanied with veins. One artery and 2 veins come together and form the bundle. But in these bundles also presents a nerve. Usually nerve, artery and veins together form neurovascular bundles. That is a special term. I recommend you to remember that terms, because such combination of vessels and nerves are very typical for anatomical organization in the body. And as you see, the arteries and veins give to the nerve small vessels which bring oxygen and take carbo-oxygen, and as well it brings artery brings nutritions and take metabolic products from the nerves, and that is absolutely obligatory for nerve function. But nerve gives also some branches. Usually it is the white and thin nerves come to the artery and veins and innervated them. Why it is necessary? Because contraction of muscles in the muscle cells in the arteries and veins wall are absolutely necessary for blood pressure regulations. That's why this process is under control of nervous systems, and arteries and veins take nerve regulation, take innervations from the nerve, take some branches, and are, as we call, innervated by the nervous systems. And in the end of our lecture, I'd like to show you some main arteries, arterial vessels in our body. Firstly, I'd like to tell again that that is the systemic circulation, arteries of the systemic circulation, in other words, circuits, and that is, of course, they started from aorta, and then all of these arteries are branches of aorta, of branches of aorta, of aortic branches. And the second group of arteries called arteries of pulmonary or small circuits. They carry venous non-oxygenated blood in comparison with the arteries of the systemic circulation, and they come to the lungs and bring the blood with the low concentration of the oxygen and high concentration of carbo-oxygen, or in other words, non-oxygenated blood. And we distinguish group of arteries located in the head, or head arteries. Some of arteries, quite large arteries, located on the neck. We distinguish also group of trunk arteries or body arteries. Sometimes we call it soma, arteries of the soma. Soma in Greek means trunk. And a group of limb arteries. You see here arteries of the head and neck. This is the trunk arteries, and here limb arteries, upper limb and lower limb. It is absolutely necessary to remember the name of such a large vessels as aorta. Aorta start from the left ventricle, and first part of aorta is named ascending aorta. Telling true, the small first segment of aorta, usually connected with the heart, is called bulbus of aorta, bulb of aorta, and then it continue in ascending aorta. Then we see aortic arch. It's usually look like an arch, and then it continues in the descending aorta, or descending part of the aorta, and it is located in the chest, and that will be thoracic parts, and the end part of aorta is located in the abdominal cavity, and so that's why it is named abdominal part of aorta. Here you see aortic bifurcation, and usually typically it's located in the level of the fourth lumbar vertebra. Here, interesting clinical examination of aorta. That is aortography, we call it such. That is X-ray examination, some kind of X-ray examination, and all of part of aorta are good visible. Here is a bulb of aorta. Then we see ascending part of aorta and aortic arch. Then descending part of aorta, number 7, that is a thoracic, but number 8 is abdominal part of aorta. And here is visible abdominal part of aorta, it was not true. Number 9 is abdominal part of aorta, but number 7 and 8, that is all of 2 parts of thoracic aorta. And here you see the bifurcation abdominal aorta into the common arteries, iliac arteries, left and right iliac arteries. And such a picture could show you, and it is nicely seen, the thoracic and abdominal aorta in CT scan. You see the diameter of aorta is equal, almost equal on different position, and if doctors see such enlargement of aorta, they talk about the aneurysm, aortal aneurysm. Typically, this enlargement located in abdominal part, and very often it needs such patients need to be operated. It is also possible to found aorta by the ultrasound scanning, and that is visible the dark part of aorta, because the blood is looks like dark fluid, and doctor now may registrate the flow, the speed of flow of blood, and it should be this direction, because here it is the bifurcation, that is the place of aortal bifurcation. And I'd like also to show you the first branches starting from the aorta, and that is of course coronary arteries. They bring blood to the tissue to the heart tissue, and they are responsible for good blood circulation in our main organ of the circulatory system, I mean heart. Where is the places where started coronary arteries? There are two coronary arteries, right and left. The left coronary artery started from the left position of aorta, and that is what we call sinuses of aorta, because they located between semilunary valves in the aorta, and I hope you remember such shaped balcony shaped valvules, and between the wall of aorta we can see opening of the coronary arteries, and such spaces we call sinuses, aorta sinuses or valsalva sinuses, and right and left sinuses are places where coronary arteries started. Left artery is very short, have short lengths, because it has bifurcation between anterior interventricular artery branches, and circumflexus branch. We call that ramus interventricularis anterior in Latin, and ramus circumflexa. Right coronary artery go in the coronary sulcus. Here is the sulcus coronary, and it gives name to the coronary arteries because sulcus coronarius, and small branches come to the right atrium and right ventricle, and continue in the posterior side, to the posterior interventricular branch located in the posterior posterior inferior surface of the heart. Left picture. Here show you the coronary arteries with atherosclerosis process, and it is the problem for patients because the blood couldn't come to the heart, and usually it stimulated heart attack. Some of heart pain patient feel in their chest, and without medical help people can die. So you see here the typical surgical operation which is called coronary revascularization, and some of the veins are used for additional vessels connecting aorta to the normal, not contracted parts of the arteries. And as you see here, visible that this point, this place, and this place are lack for blood could not come in this area. So doctors use the collateral or additional vessels to bring blood to the heart, and usually it saves patients life. Some main and large branches of the aortic arch are bronchocervical trunks. Then you see left common carotid artery, and the third branch is left subclavian artery. Only 3 branches come from the convex side of the aorta, and some of small arteries are started from concave side of the aortic arch, and such branches we call bronchial branches and thymical branches are responsible for blood circulation in bronchs and the central organ of immune systems called thymus. Don't forget that the first branch of convex side of aorta, brachiocervical trunks, further in close to the neck, divided into the right subclavian artery, that is here, or that is here, that is brachiocervical trunks, and that is right subclavian artery, and the second branch is called right common carotid artery, which bring blood to the brain and neck organs. Here also visible is nicely see the angiography of aortic arch, and we see the bronchocervical trunk, left common carotid artery, and left subclavian artery as well. I think that's enough for now. Another arteries you will study together with me or our professors in your practical lessons. I recommend you to study. Don't spend your time and try to to study arteries and heart, because in the beginning of September or in the end of August, I think it will be the beginning of September, you will have practical lessons, and our teacher will ask you to come to the lessons good prepared. That is all for now, and I open for your questions. If you have such questions, please let me know. Oh, I see a lot of students registered in the lecture. Even now there are zero students. Well, please don't forget to pass the test. Today's test is located in Moodle, and it is for arteries systems. I do recommend you to pass this test, and if you have questions, you can put your questions in the forum, Arterial System forum, which you also could find in the Moodle. Because I didn't see any questions, let me wish you a good result on your exams and good vacations. I hope you all visit your homelands and come back in St. Petersburg to be ready continue your education in our university for the second year. Thank you for your attention. It was the last lecture. As usual, I, Professor Starchik, was glad to be here and hope to continue our lecture in 2 months. Thank you for your attention, and goodbye till September.